Hi, this is Elliot Fishman, and welcome to our latest vodcast. And this is going to be on benign polypoid gastric lesion, looking at pearls, pitfalls, and differential diagnosis. And this is actually based on an article that's in press. This is by Hajra and Linda, myself, in Abdominal Imaging, and it's in press in March 2026. But you can read it now, and this article will look at the specific findings that you could see, ranging from things like lipomas to leiomyomas to glomus tumors to schwannomas to heterotopic pancreas and gastric antral vascular ectasia, amongst other things. We have a second article that's being published that's on malignant polypoid lesions, but that's a subject for a different day. So let's get started and let's look at this. So in this article, we make the point, any discrete protruding lesion in the stomach seen on endoscopy or imaging can be described as a polypoid lesion. They most commonly represent benign gastric polyps that originate from the epithelium, but they also can represent benign gastric masses, which is the subject of our talk, ranging from glomus tumors to lipomas to leiomyomas, schwannomas, gave, and heterotopic pancreas. Now, the lesions at times do have some overlap, but in other cases, you can be very specific as to their diagnosis. Glomus tumors, for example, are hypervascular. If you think about the big picture differential diagnosis, perhaps comparing them to a carcinoid, maybe in the differential or a vascular GIST tumor. We talk about lipomas, which are fat attenuation, well-defined. We talk about leiomyomas, well-defined, and soft tissue density. Again, challenge for leiomyomas would be distinguishing them from GIST tumors, perhaps. Schwannomas are rare, and it's an unusual tumor that it increases enhancement over time. Heterotopic is always an unusual diagnosis. Looks like a polypoid lesion, more common in the antrum, and is typically more vascular, kind of enhances like the pancreas. You can see heterotopic pancreas in the duodenum or in the stomach, most commonly antrum, but theoretically can be anywhere in the stomach. These gave or gastric antral vascular ectasia is supremely rare, and it occurs in the antrum of the stomach. We talk about a watermelon stomach with this. That's how it's described on endoscopy. So again, we need to think about these benign lesions as we move forward. Now again, gastric lipomas are uncommon. We see lipomas in the stomach, in the esophagus, small bowel, and in the colon. When they get large enough, they can ulcerate and bleed. We also can see when they get large enough, they can intussuscept. Most lipomas are small, however. They're incidental findings. They do not become liposarcomas over time, okay? They're most commonly found in older adults, mean age of about 55 years. When we speak about the stomach, they're usually solitary, though occasionally you can have multiple lipomas, and they can be associated with things like Proteus syndrome, PTEN, hamartoma tumor syndrome, which is really rare, familial multiple lipomatosis, and tuberous sclerosis, where you see lipomas or myelolipomas in the kidneys, for example, as well. The hallmark of a lipoma, well circumscribed, usually measuring between -70 and -120 Hounsfield units. Again, when they get larger, they can ulcerate. Most lipomas do not ulcerate. Most are picked up incidentally, and particularly when they're small, under a couple centimeters, are typically going to be left alone. There is no potential for malignancy, and the smaller ones just are not going to cause problems, so there's no need to pursue them further. Here's a nice example of a lipoma sitting in the antrum of the stomach, off the lesser curvature, very well defined, measured about 190 or -190 to -110 Hounsfield units. It's interesting with lipomas that you can see a thin septation. You know, with lipomas in the retroperitoneum, we start worrying about septations and liposarcoma. I've seen one case of liposarcoma of the stomach over time, but then it was a huge mass, really vascular, really irregular. This is a simple lipoma. Here's another example, again in the antrum of the stomach. This low-density lesion, which measures fat density. Very nicely shown, and it's a lipoma. And here's another one. This only came down to about 30 on these images, but if I measured it a little bit more carefully, I got -10. So you're not always going to get -100. You might get -10 as well, depending on partial averaging. But again, once you're in the negative range, you're always dealing with lipomas. And here's that same case again in the coronal perspective. And there's your lesion right here and right there. You can see the fat layering out. Now, another lesion, we talk about fat, then let's talk about soft tissue. Gastric leiomyomas are uncommon. They're defined as spindle cell tumors arising from the smooth muscle cells of the gastric wall with low or moderate cellularity. They're typically strongly positive for smooth muscle actin and negative for CD3 and CD117. And these are, of course, positive in GIST. So the way you can distinguish GIST from leiomyoma, obviously, is pathologically. We talk about soft tissue lesions when they're small. We think about leiomyomas when they're larger, let's say over 3 or 4 centimeters, surely 5 cm, with basically calling them GIST tumors. Now, that does work most of the time, but you can get small GIST tumors, so it's not a perfect rule. It's important to recognize characteristic imaging findings to differentiate leiomyomas from GIST tumors. Again, most GIST tumors, because of concern for malignancy or continued growth, will be removed. Leiomyomas are benign and do not require surgical intervention unless symptomatic. Occasionally they can bleed, whereas GIST can be malignant and you need surgical resection. Sometimes you'll have to do endoscopy with biopsy to make certain, and sometimes when they're small, 2 or 3 centimeters, once the endoscopist goes in, they'll simply remove the lesion. Here's a nice example of roughly a 1.8 centimeter lesion near the fundus of the stomach, soft tissue density, well defined. We thought about a GIST, we thought about a leiomyoma. This was resected and was a benign leiomyoma. Here's another example of a lesion with a small ulceration near the fundus of the stomach. Again, leiomyoma is a possibility. GIST tumor is a possibility. Here it is again. Hard to be certain. Again, biopsy or just simply removing it, which at the end of the day will get rid of the problem, is what will happen. This was removed, and this was simply, as shown, a leiomyoma. Just a very, very nice example. Again, this case also makes the important point to remind everyone about scan protocols. If the stomach is well distended, it's easy to see gastric lesions. If the stomach is not well distended, particularly small lesions will easily be missed. And again, just a nice example. In terms of GIST and leiomyomas, there can be, particularly with GIST, some enhancement, but they're typically not hypervascular like you might see with heterotopic pancreas, or you might see with other tumors, including neuroendocrine tumors, for example. Now again, this idea about separating leiomyomas and GIST tumors of the stomach can be challenging. Large leiomyomas with necrosis or cystic generation can overlap very clearly with GIST and even leiomyosarcoma. In this article by Wang, he found that cardiac or cardiolocations, endophytic growth patterns, absence of necrosis, gradual enhancement, long diameter, short diameter measurements could be helpful. But again, this is really a lot of features, and I have to admit, when I start looking at 20 features trying to distinguish a leiomyoma from a GIST tumor, I'm simply going to say there's a soft tissue mass, could be a leiomyoma or a GIST tumor, recommend endoscopy, and at the end of the day, it will probably be removed. We mentioned also that leiomyomas can resemble other tumors, including things like schwannomas. Schwannomas are very rare, so it's typically not going to be a problem. One of the things about schwannomas, they can have increasing enhancement over time. Leiomyomas and GIST tumors actually kind of wash out over time. Again, in terms of when you're uncertain, I think biopsy will be done or simply the lesion resected. Sometimes the challenge is on biopsy, the pathologist cannot be positive. And so when they speak to the patient, they'll kind of describe it, say, hey, we can do a partial gastrectomy, or we can laser out the lesion. You'll do fine. There's no complications. Let's just solve the problem and not worry about it over time. Now, I mentioned with GIST what can be helpful. This was a GIST tumor. See, I would not call this a leiomyoma because leiomyomas protrude into the lumen. This lesion is exophytic. One of the things about GIST tumors, this is true in the stomach or small bowel, they tend to be exophytic. And this is just a really nice example of an exophytic lesion. Very, very nicely shown in this example. And here's another example near the fundus, but again, it's low density. I admit I would have a hard time in this case. Okay, I could call this a leiomyoma and be correct. So this is one of those leiomyomas that looks very much like a GIST tumor. There really is no good way of being able to separate it. Again, well-defined, sharply marginated, homogeneous, but really a difficult diagnosis. Now, there are other tumors. When we think about vascular lesions, I mentioned before heterotopic pancreas. The classic mucosal lesion in the stomach is going to be a glomus tumor. Glomus tumors in general are pretty rare. They're usually small benign neoplasms. They can occur in multiple different organ systems. They're a bit more common in females. Patients are in their 50s. Here's a nice example. This was a glomus tumor. You can see it here. I have to admit, if I looked at this case, I would look at it, and my first thought would be, this is a leiomyoma. My second thought would be, could it be a GIST tumor? I don't like to call anything a glomus tumor, or I don't even think about a glomus tumor unless something is very vascular. And in this case, the lesion is not very vascular. On the other hand, this lesion, submucosal, very vascular. Okay, there it is, right there. I'll show it to you a few different ways. That's a glomus tumor. Right there it is on the coronal views, submucosal, hypervascular, classic for a glomus tumor, and it kind of protrudes into the lumen. You can see when you use the endoscopic software that's a polypoid lesion, which is what the endoscopist will see. Just a really nice CT and what would be endoscopy correlation. And here's another example in the antrum, again, very vascular. Again, what would your differential be? Well, you could mention carcinoid tumors or other neuroendocrine tumors. You can mention if the patient had a renal cell. Occasionally, I've seen renal cell carcinoma metastatic to the stomach. That would be a possibility. But if it's the only finding vascular lesion, you need to think about a glomus tumor. And this is just a really nice example. And again, the last two cases are very classic glomus tumors. The prominent vascularity really gives you the correct answer. Now, as we look at other lesions, in terms of these glomus tumors, patients can present with GI bleeding. And again, anything very vascular can present with GI bleeding. We talk about that differential diagnosis, which can be somewhat challenging. Again, other submucosal lesions that are vascular. We talk about things, again, heterotopic pancreas, which is a challenging diagnosis. We talk about carcinoid tumors or other vascular malignancies. Okay, what else? Gastric schwannomas. Let's do this. Let's stop here and take a few-minute break. Think about what we've talked about, the leiomyomas, the glomus tumors. Think about those for a second, the GIST tumors, and let's come back in a few minutes. And I'll see you then. If you like this video, make sure to subscribe to the CTisus YouTube channel. You can also visit us at ctisus.com for even more videos, plus quizzes, pearls, protocols, and oh so much more. We're also in the App Store and have well over a dozen apps for iPhone and iPad, all completely free. Thanks for watching.